Good morning, everyone. It's a pleasure to be with you once again. I'm sorry that we're not meeting in person, hopefully next year. I'd like to thank Dr. Sundar and members of the organizing committee for inviting me to speak at this prestigious meeting once again. I'm going to be talking about clinician self-care, how we can reduce burnout and become more resilient, both as healthcare professionals and in our personal lives. I have no relevant disclosures, although I suppose I should mention that I wrote a book, Shameless Pandering, and I will be talking about some of the elements that are central to the themes of this book. I realize that's a bit like my favorite sign, showing that slide. But in any case, we're going to be talking about how we can take better care of ourselves and become more resilient. First of all, we'll just mention what burnout is, although I'm sure many of you have read about it and perhaps experienced it. Talk about the drivers of burnout and also its costs. I'd like to tell you a little bit about our program at Stanford called WellMD, and then about my approach to mindfulness. I would call it presence practice. I think that helps me become a more resilient person and clinician as well. Burnout is simply a state of physical and emotional exhaustion caused by chronic stress. And we've all experienced stress. Acute stress may be adaptive. It may help us have a surge in epinephrine and cortisol and jump in the pool after the toddler who fell in after we heard the splash. But when that condition, that heightened sense of alertness and fight or flight response lasts for more than a very short period of time, becomes maladaptive. And when it lasts for more than hours to days, it certainly becomes a chronic problem. This results in our having a negative attitude toward our job, low self-esteem, our patience is worn thin, we're fatigued. So this chronic stress is clearly a problem in our lives, not just related to our work, but life in general, which is full of its ups and downs and stressors. When we're chronically stressed, we have an increased level of epinephrine and cortisol circulating in our bloodstream. And of course, the adverse effects of adrenaline or epinephrine are well known to all of us, the effects on our cardiovascular system. The elevation in cortisol plays havoc with our immune system. We also have other hormonal abnormalities associated with chronic stress. And of course, our sleep is impaired. And when our sleep is impaired, we are fatigued. We tend to reach for so-called comfort foods that are high in sugar and fat, definitely not healthy. They may give us a temporary boost, but then we crash. And also when our sleep is disordered, we tend to do away with our exercise regimen, and so we get into this self-propagating cycle of fatigue, poor diet, inadequate exercise, poor sleep, and further fatigue. When we talk about quality, we've generally considered improvements in patient care, lower costs, and better outcomes. I think what we haven't paid much attention to historically is our own wellness, and I'm not just referring to physicians, of course, but to nurses and other healthcare professionals. I think really this needs to be the fourth element in this pie chart or the equation of quality. The ASA issued a statement on burnout several months ago, and they highlighted that burnout leads to an increase in cardiac disease. We talked about the increase in serum epinephrine concentration with chronic stress. This leads to hypertension, predisposes to coronary disease. We have increase in cortisol levels that predispose to hyperglycemia and type 2 diabetes, and other adverse effects on our physiology related to burnout. The risk seems to be greatest in our younger physicians and nurses. This includes our trainees. And unfortunately, when they're burnt out, they have a higher incidence of substance abuse and sadly, an incidence of suicide. So we really need training to recognize burnout and to learn how to take measures to prevent burnout and decrease its effects. And this was again issued as a statement on burnout by the ASA House of Delegates back in October. Let's talk a little bit about the drivers of burnout. I'm sure these are familiar to all of you. We can start in the upper left-hand corner of the slide. Certainly, we're all exposed to increased performance measures, Press Ganey surveys, etc. We feel that these metrics are sometimes inappropriate. We're being held responsible for issues related to performance over which we have no control, such as late starts, which are often caused by patients arriving late, or issues in the preoperative area. Turnover times are scrutinized, and again, we may be cited even though we have no control over getting the room ready in time, and other issues with the preoperative processes. So we feel a loss of control over our work. We're being held responsible for things over which we have little control. Inefficiencies in the practice environment are certainly paramount with regard to chronic stress and burnout. This can include, again, right sizing of the number of anesthesia techs and orderlies with regard to stocking our operating rooms and turning the rooms over efficiently. And 10 minutes here, 20 minutes there in delays between cases, and pretty soon we're in the hospital for an extra hour or hour and a half, and we've missed dinner with our family and missed events with our kids. So clearly this is going to be a source of stress and unhappiness. The electronic medical record is in everybody's top 5. That is with regard to stress and unhappiness. When there are problems with the electronic medical record, it can stop us in our tracks, may actually prevent us from getting a case started. So at times it seems like the EMR creates extra work for us, even though it's designed to do the opposite. And of course, our patients are getting sicker and sicker, and this also leads to an increase in stress. We've talked about the drivers of burnout. What about the costs? Well, it's been shown that there are more surgical errors when surgeons are burnt out. This is an article by Tate Shanafelt, who's our head of wellness at Stanford and the head of our WellMD program that I'll discuss briefly in a few minutes. There's also an increase in medication errors among physicians who are burnt out, an increase in infections, probably caused by physicians failing to take simple measures like hand washing, preparation of ports, and so on when we inject medications. When we're burnt out, our patience is thin, our practice deteriorates. And there is an increase in mortality rates as well. This is a paper from 2015 showing that patient safety is compromised when caretakers are exhibiting burnout. So clearly these are great costs, and perhaps the greatest cost of all is that related to burnout, there's more than one physician suicide each day. And about 1 million patients a year lose their physicians related to suicide. So it's quite a large and important problem to address. So we've talked a little bit about burnout, what it is, what the drivers are, what the costs are. Let's transition now to what we can actually do about it. This is where there's a relative paucity of information in the literature. We're great at describing the problems and lag behind a little bit in its solutions. But in order to try to identify solutions and implement them, the WellMD program at Stanford was convened several years ago. I think it was we were the first major medical center that started a wellness program on a broad department-wide and school-wide basis. And those in the WellMD program helped formulate this rubric for professional fulfillment, which can also be substituted for burnout when these elements are awry. So we have a pie cut in thirds, and these are the 3 domains of professional fulfillment or potentially unfulfillment. The first is the culture of wellness. So this really pertains to the environment in which we work. Are there a lot of aggressions, macroaggressions, microaggressions? Is it an environment in which there's punitive action if we need help, we need time off? Is there help offered in terms of psychological support within the department and the school? The second domain is efficiency of practice, and we've talked a little bit about this. This really pertains to turnover times, late starts, adequate stocking of the rooms, the entire perioperative process. So It begins with preparation of patients for surgery and follows with the processes that occur in the registration area and in the preoperative areas, the exam rooms, etc., including the operating room experience and thereafter in terms of the recovery room. We have the occasional problem of the recovery room being full because of inefficiencies in moving patients out. This means we have to stay with our patient in the operating room until there's a bed available there. The third domain with regard to professional fulfillment is personal resilience. And this is really my primary area of interest. And I think some of us have been turned off by discussion of resilience because it's been presented in a way that makes it seem as though if we're more resilient, we can prevent burnout. And I think that is not the case. That's why we have a pie with three domains: culture, efficiency, and personal resilience. So no matter how resilient we are, if we work in a culture that's full of aggressions and biases, I think we're not going to be happy. No matter how resilient we are, if we're staying an extra hour or two in the hospital every day because of clinic and perioperative inefficiencies, we're not going to be happy no matter how resilient we are. So I think we really need to address all three of these issues. So first we can talk about the culture of wellness, and perhaps unwellness is something that we all experience, unfortunately, in our programs. Issues that have been identified in terms of unwellness include a lack of accountability by leadership, this culture of fear with reprisals, whereby asking for help is considered a sign of weakness, lack of equity within the department or perceived equity with regard to non-clinical time or academic time, our salary, our bonuses. So when there seems to be a lack of transparency and we feel as though our colleagues are being treated differently than we are, this of course leads to unhappiness. In some cases, there's a lack of respect by our surgical colleagues, sometimes by operating rooms. I hear this primarily from the trainees, fortunately not at the Children's Hospital, but elsewhere. Trainees feel as though they're somewhat disrespected by circulating nurses and other staff, technicians in the operating room, despite our trainees' best efforts to ingratiate themselves. Lack of control over our schedule is a very big cause of unwellness, especially when it results in unpredictability at the end of the day. We end up working late and we may not have much control at all over our daily schedule, but also our monthly schedule. The second domain that we need to focus on is efficiency. We hear a lot about inefficiencies where those of us who have a clinic practice may just have more and more patients. The administration is asking us to see more patients per hour, but we don't have enough exam rooms, we don't have enough staff. And this is a problem largely outside of anesthesiology, where physicians are being rated by Press Ganey and other organizations. Patients are unhappy because they're waiting longer and they're spending less time with their physicians. And the physicians themselves have no control over this, yet their Press Ganey scores go down. OR turnover times, we've talked about another significant element of efficiency or inefficiency. The surgeon's times being appropriately scheduled so that our list that's scheduled to end at 4 o'clock in the afternoon ends up going until 7 o'clock. And again, EMR systems, our electronic medical record software platforms, are consistently near the top of the list of complaints regarding efficiency. This is kind of an interesting graphic that was part of an article published by Alfonso and others in anesthesiology a few months ago. The fire among us, burnout in anesthesia. You gotta love these icons. About 60% of us are at high risk for burnout according to their definition. A lower percentage of us actually meet the criteria for what they call burnout syndrome, which is really kind of burnout in its most severe manifestations. Those at high risk cite perceived lack of support at work, long hours, LGBT discrimination in many cases, and perception of staff shortages. Those who are truly burnt out also report lack of support at work or the perception thereof, and also lack of support at home. So there's a lot of attention again to what burnout is and what causes it, not enough attention perhaps to its remedies. But the article did point out that lack of support in work-life balance is part of the solution, or at least the problem that we need to address, and that solution should focus on leadership skills, self-care, and balancing resources and demands. Of course, easier said than done. I think my favorite reference for pointing to the solutions in order to prevent, mitigate, and treat burnout is in this book by Swenson and Shanafelt out of the Mayo Clinic. It's a little bit costly, but I think it's well worth the investment for those of us who are really interested in how our departments and hospitals and medical schools can really start to address the issue of burnout and come up with very creative and important, meaningful solutions. This was published in 2020, I think, just after we had recruited Dr. Shanafelt from the Mayo Clinic to head our WellMD program. Dr. Shanafelt actually published an article in Anesthesiology more than 10 years ago looking at the solutions with regard to the culture and efficiency of practice to the problem of burnout. Tate highlighted that organizational and policy changes needed to be made, and that really what we need are system-level interventions, optimizing workload, reducing turnover times, right-sized staffing in the pre-op area, in our operating room technicians and orderlies, reducing the administrative burdens that are placed on physicians, and also doing what we can as institutions to promote culture of compassion, engagement, and also promoting meaningfulness in our work and support to all of our faculty and healthcare professionals. And so we did recruit Dr. Shanafelt several years ago and convened this WellMD program actually before he arrived. And it's funded jointly by the hospital and the School of Medicine. And this really highlights the recognition of the importance of this problem of burnout and the commitment by the institution and institutions really to remedy this problem. I pointed out that the WellMD program embraces this rubric for professional fulfillment, and there are really three important domains: wellness through improvements in the culture, improvements in efficiency of practice, and providing programs and encouraging us to become more personally resilient. So what can we do as individuals to become more personally resilient? That was really the topic of this talk. First, we can talk about our physical well-being. I think there's a tripod of three elements of our physical well-being comprised of sleep, exercise, and nutrition. And we're all very well aware of the importance of these three elements in our lives, and yet we're not so good at implementing improvements. So for example, with our sleep, this is something I had not focused on, was the long half-life of caffeine, which is ironic since I do pharmacology research in my lab. But caffeine has a long half-life, and so this means that the cup of coffee that I was having after lunch, when I tended to get a little bit sleepy at 1 or 2 o'clock in the afternoon, half of the caffeine in that coffee was still with me at dinner time, and a quarter of it was still circulating in my bloodstream when it was time for bed. And if you're like me and very sensitive to the effects of caffeine, this can really disrupt our sleep. Alcohol similarly disrupts restorative sleep. It really is, it's an anesthetic. And so just as our patients under anesthesia or even under sedation are not really getting restorative sleep, when we drink alcohol proximate to the time of going to sleep, have our sleep disrupted. Also, we need to avoid screen time in bed. The screens, including our phones, laptops, computers in general, have no place around our bed. Our bed is for two things, and they do not include using our phones and having a laptop with us. So these are all things we know but don't always implement. What about exercise? So this is a topic of a much longer talk, but 5 hours of relatively vigorous exercise a week has been shown to reduce our cardiovascular risk, improve our sleep, has many other benefits on lowering our stress, our serum epinephrine and cortisol levels, for example. But if we can't accomplish 5 hours of vigorous exercise every week, let's keep in mind that any exercise is better than no exercise. And so if we're working at home, if we can take breaks and even just do a brisk walk around the block a couple of times, this is quite helpful and will help us sleep and feel more calm and de-stressed. So let's get as much exercise as we can. Nutrition, again, a special interest of mine. That's my undergraduate degree is in nutritional science, and I've always really focused on nutrition in my critical care practice. When I was a teenager, I became a vegetarian, and ever since then have really embraced a plant-based diet. And I think, of course, there are many, many diets out there that people follow or attempt to follow. The Atkins diet, for example, low carbs, a variety of low-fat, so-called keto diet, for example. I won't go into detail on those. I'm not convinced that any of those are particularly helpful. I think balance is good, and I think moving toward a more plant-based diet is definitely in our best interest. So this is our physical health, resting on sleep, exercise, and nutrition. What about our mental, emotional, spiritual health? So we hear a lot about mindfulness. What is mindfulness? Dr. John Kabat-Zinn, who I think is really one of the founders of the mindfulness movement, if you will, in the United States today, is one of my heroes, started a mindfulness-based stress reduction clinic at the University of Massachusetts back in the 70s. He defines mindfulness as the awareness that arises from paying attention on purpose in the present moment, non-judgmentally. And I've highlighted on purpose because we need to be intentional about having a practice that will help us gain a greater level of personal wellness. The present moment, yes, so important because we tend to be distracted by thoughts of the past and future that are not necessarily adaptive. And we're also extremely judgmental. We analyze everything in our environment, and we really spend a lot of mental energy comparing things to each other, to ourselves, comparing ourselves to other people, often unfavorably. And so this is hardwired into the way our minds work. And the good news is that we can rewire our brains if we're purposeful about it. I'd like to put forward the notion that we can't rely on vacations to focus on becoming more present, relaxed, non-judgmental. We all know that after a week off, we come back and a day in the operating room or the clinic seems to erase the benefits of that lovely week off we had. So I'm going to really propose that we embrace a daily practice, even just for a few minutes a day. And I think that can really, over time, produce very, very fruitful results. Why do we need a daily practice? Well, our brains have become hardwired over millennia in ways that interfere with our ability to be happy and predisposed to burnout. For one, we have a negativity bias. We tend to remember the negative and forget about the positive. I have an example in the book where I work with a trainee who did 4 difficult cases. She did lots of procedures: arterial lines, central venous catheters, epidural, double lumen endotracheal tube. She missed an art line, so I had to step in and do that, but she did everything else right. She went home at the end of the day and had a dinner with her husband, and as she prepared for bed, she took stock of her day, and did she think about all the things that she did well that we focused on during debriefing at the end of the day? No, she was very focused on having missed that one procedure, the arterial line that Dr. Hammer had to step in and do. So that's just an example of our negativity bias. We also, unfortunately, have an obsession with the past and future, and it's adaptive to think about the past to the extent that we learn from our mistakes and we savor our wonderful memories, and adaptive to think about the future so we can plan for happy times and plan to put bread on the table. But beyond that, our thoughts of the past often lead to shame and remorse and self-judgment, and our thoughts in the future lead to fear and anxiety. And so we need to identify our thought processes intentionally and recognize when we're being maladaptive in our thoughts, as our brains have unfortunately become hardwired to do. So we are often stuck in the past and the future. Our brains are kind of hardwired to go in these circles where a lot of energy is expended non-productively. Happiness lives in the present moment. So how can we learn to be more present? How can we learn to rewire our brains? And I think it's not complicated, but we need to be very purposeful about it. We talked about wellness, nutrition, sleep, exercise, and I think that having a daily practice where we learn to rewire our brains to be more positive and more present is extremely important. Because if we think about all the times that we've been really happy, it's when we're not thinking about the past or the future. We're walking through a grove of tall trees, marveling at their majesty with the sunlight filtering through the canopy, and we're not thinking about the unfortunate event of yesterday or the list of things we have to do when we get home. We're just in the moment, and that's when we're truly happy. So we can learn to be more present if we practice several principles on a daily basis. It does take practice. A little progress every day is all we need. There's no such thing as failure. And slowly but surely, with little bit of practice every day, we can look back after several months of practice and realize how much progress we've made and how much happier we are. So I'm just going to talk a little bit about what's in my book, this practice called GAIN, which is centered around gratitude, acceptance, intention, and non-judgment. And what I'd like to do is close by just doing a very brief GAIN meditation, which I do every morning. And this really plants these ideas in our minds, and we can then kind of refer to them throughout the day as we're walking down the hall toward the operating room, or taking a lunch break, or talking to a patient, or preparing to do so. So let's all close our eyes. This will be brief. This is a practice that I recommend for doing every morning after we wake up and open the blinds and do our morning hygiene thing. We find a comfortable place to sit, close our eyes, and let's get in touch with our breath. So just feel the magic of the air passing through our nose as we take a breath in, slow it down, pause for a moment, and then without effort, just let it go. Focus on the breath is important because it's always accessible, it's always with us, and we can associate our breath with the elements of the GAIN practice. Slowly breathe in, pause, and breathe out. And our attention goes to our gratitude. We have so much for which to be grateful. We're grateful for the privilege of caring for our patients. We're grateful for the camaraderie we experience at work with our friends and colleagues. It's really an honor to be able to do this work, to be helpful to other people. This is what leads to sustained happiness, the so-called eudaimonic happiness, and we're grateful for that. We're grateful for our relative health and wealth. We're grateful for a safe place to live, especially given what's going on in the world these days. And we feel this fullness, this warm glow of gratitude. And we transition our thoughts to acceptance because there's pain and joy in life. Pain is inevitable. There's a formula in the book that is suffering equals pain times resistance. So the pain is there. I suffered the pain of a child's death several years ago. That pain will never go away. But the more I open my heart to it, the more I lower my resistance and accept the pain, the less I suffer. So we all have pain. Think of a painful experience and imagine opening your chest, opening your heart, letting this pain in till we merge with it, till it's part of us. It's not as bad as we anticipated. If we ask ourselves the question, can I live with this pain forever? The answer is yes. And we move to intention. We recognize that we can be purposeful and rewire our brain to be more present and happy. We think of the effect of just imagining 3 good things before we go to sleep at night. And it's been shown in this study at Duke University that just thinking of 3 good things that happen during the day before we go to sleep actually helps us sleep better and it makes us happier. So we use this opportunity just to think of 3 things that went well the previous day. 3 positive things in our life. We're purposeful about this. We transition finally to non-judgment. We picture the Earth suspended in space with one of these beautiful NASA images, and it's clear that the Earth is neither good nor bad. We don't have to label the Earth as good or bad. We don't have to label anything as good or bad. We just see things as they are and accept them as such. And if the Earth is neither good or bad, it's only logical that we ourselves are neither good or bad. We are just the person we are. We embrace this. We drop all judgments of ourselves and others. We go back to the breath, slowly inhaling, filling our lungs, expanding our chest, pausing, and releasing the breath without effort. And we repeat this. Focus on the breath, bringing gratitude, acceptance, intention, and non-judgment. And we slowly open our eyes, and we're ready to go out in the world. And I thank you all very much for your attention.